In a developing story, a big change from the CDC is raising questions for new parents. For years, newborns have gotten their first hepatitis B shot within the first 24 hours of birth.
Well, now a national advisory panel is recommending a delay. But Fox 23's Kennedy Hobbs spoke with a pediatrician with St. Francis Health System who wants parents to know that recommendation is not a mandate.
As of right now, Dr. Campbell says St. Francis will keep their 24-hour birth dose, and he urges you to talk with your primary care physician.
A big change from the CDC is raising questions for new parents. A national advisory panel is now recommending that newborns may delay their first hepatitis B shot, a shot that's long been standard within 24 hours of birth, but local pediatric leaders say the science still points one way.
Should a newborn within 24 hours have the hepatitis B immunization? Should there be a delay in that immunization, or should there be a recommendation for no immunization? Currently, with an 8-2 vote through the ACIP, the recommendation changed from the first hepatitis B immunization within the first 24 hours of birth to perhaps a delay, with further discussion of what does that delay look like. Perhaps at a 1-month interval, perhaps at a 2-month interval, instead of within the first 24 hours. Right now, as it sits, we will follow the American Academy of Pediatric recommendation. That has been the recommendation for over 30 years to give the hepatitis B immunization within that first 24 hours of birth.
Dr. Campbell told me that guideline has existed since 1991 after data showed too many infants were contracting hepatitis B, often without mothers knowing they carried the virus. Before the universal at-birth recommendation, the U.S. saw nearly 20,000 pediatric cases of hepatitis B each year. Today, that number has dropped to about 20, a dramatic decline attributed to early immunization.
400 studies over 4 decades have shown that it could be linked to the hepatitis B immunization recommendation going to immunizing that baby at birth to protect them. The difficulty with hepatitis B in the adult is about 7 to 8 out of 10 who have hepatitis B don't experience active symptoms, and so they don't know that they could possibly be transmitting that virus. About 16 to 20% of moms do not get tested for hepatitis B, so that's about 16 to 20% of babies that could have exposure to hepatitis B without the parent knowing.
Physicians emphasize that despite national recommendations, every family should have an individualized conversation with their doctor to decide what's best for their newborn. Dr. Campbell says it's always recommended that moms get tested in their first trimester to prevent the exposure to their newborn.
Bottom line is, the vaccine is still important, just on a different schedule. In the newsroom covering news that matters, Kennedy Hobbs, Fox 23 News.